Hi everyone, this is Dr. Stringer again. You should have already read the chapter, but we are talking about psychoactive drugs and drug use and abuse this time. So hopefully you've enjoyed the class so far, and we're going to just dive into this. Hopefully you've already read the chapter, so this will just be kind of a refresher, although I know some of you like to wait until the last minute and probably are just watching my video. But I would encourage you to read the chapter too. This book is really good and it's pretty short chapters too, so it shouldn't be too much trouble for you to follow along in the book either. Anyway, so with that said, I will try to click on our slideshow here and see if we can change. Okay. Here's my clicker. Okay. So what is a psychoactive drug? If you haven't read the chapter yet, or if you have, you already know the answer. But psychoactive drugs are essentially something that has some sort of effect on your central nervous system. That's how we define things. Uppers, downers, some things slow your central nervous system down, other things speed it up. Some other drugs have different effects on them, which we'll talk about later. Um, but beginning in the 19th century and throughout the 20th century, there's been a big shift towards utilizing more law enforcement and kind of punitive anti-drug policies, and especially in the United States and in other countries as well. And more drugs have been made illegal. And today there's growth for support for policies that entail prevention and treatment. Some places are even starting to actually legalize drugs such as marijuana. You probably heard about and we'll talk about throughout class. Is starting to be legalized. I think Utah just legalized something else at the time I'm recording this. I don't remember what it was off the top of my head. But anyway, uh, so we're starting to see a little bit of a shift in this, which is interesting, I think, within history. You have to think about it if the goal is really to reduce harmful drug use and the crime associated with it. It is important to understand that, the different types of drugs and theories about drug use, right? One policy might work for marijuana, but not for cocaine. What works for cocaine might not work for heroin. They're very different drugs. You really need to understand kind of what's causing people to use them in order to be, if you want to be able to reduce it, right? Um, there's not really any one size fits all, and the whole hammer approach to say we're just going to punish you until you stop doing it is probably the least effective, in my opinion. Um, I remember there was a Supreme Court opinion, Robinson versus U.S., I think, where they had actually criminalized being addicted to drugs, and the Supreme Court said to criminalize addiction is no different than to criminalize the common cold. People can't help it that they're addicted. Some people say, well, if they hadn't used drugs in the beginning, then they wouldn't have gotten addicted to it. Anyway, you can blame that on the person for starting to use it if you want to. But I think that if you asked most drug addicts in the world if they could have a choice, if they would, want to not be addicted to drugs or not, they'd probably choose not to be addicted. But anyway, uh, as I digress, right? So there's some basic concepts about psychoactive drugs that we'll get into a little bit. Um, Psychoactive drugs must get into the bloodstream, right? They must cross what is known as the blood-brain barrier in order to produce any effect, in order to get the person high, so to speak, right? Some drugs increase brain activity, so your uppers, what we call stimulants, and others decrease it. They depress brain activity or central nervous system activity, known as depressants. Um, the length of time a drug acts on the system varies greatly, obviously, right? So if someone takes a hallucinogen, they can be hallucinating for quite some time, or methamphetamine tends to last for a day or so. Um, Consequently, crack cocaine only lasts for 5 minutes. Some of you might even have Adderall prescriptions, and so you know that that only lasts a few hours, and then they take another pill in order to be able to stay up all night and study, right? Um, so the effective dose and the lethal dose. This is something that I like to talk about when it comes to uh, the current issues with fentanyl that we're having. Is the effective dose of fentanyl and the lethal dose are so very close that you're seeing so many people die from it because of essentially a couple of grains of salt of fentanyl is enough to kill someone, but you need like maybe 1 grain of salt or a half a grain of salt in order to get someone actually an effective high from it, so to speak, right? And so that's why we see so many people being overdosed because of these things, because it is so concentrated and so powerful. So those are things to think about as well. Relative, or sorry, not relative, repetitive drug use can alter the neurochemistry of the brain. This is getting at the idea of what you probably have heard of as a tolerance, right? For those of you that are 21, you might know that the first time you drank a beer or another type of adult beverage, that you probably had a very little low tolerance to it. My wife still has a pretty low tolerance, so we won't get into that though. But anyway, and then over time, you learned that you could drink a little bit more, um, and you didn't. You built up a tolerance to it, so to speak, right? And some people, their tolerance never really gets built up, and other people it does. Essentially, what happens, the same thing happens with drug use, right? People need to use more and more of the drug in order to get the same effects, in order to get the same high or intoxication or something like that. So these are ways to think about this. Tolerance and drug dependence tend to go hand in hand, right? The people that are dependent upon drugs in order to function tend to have a very high tolerance to them. There was a story in probation of this woman who could drink, and her she could drink so much, and her blood alcohol level was like a point 0.5, like literally point 0 or point 0.5, which if you get to a 1%, of BAC, most people would be dead. Usually at a point 0.5, not 0.05. Remember, 0.05 is, it's only like 2 beers. And that's what you see with the BAC levels. But point 0.5 means that half of 1% of your blood is actually made up of alcohol. Most people would be unconscious at that point. But this person was so intoxicated and so had such a high tolerance and dependence to alcohol, and she could drink all day long, and she did drink all day long, and that's how her body built up a tolerance to that. One of the problems also with that is that when people withdraw from alcohol and drug use, they stop using it. They have significant withdrawals because of the changes to the neurochemistry of the brain, cause their body to get used to it, so to speak. And then when they don't have it anymore, it causes all of these withdrawals. Alcohol and heroin, things like that being some of the worst withdrawal symptoms. Anyway, and the cross tolerance means an immediate tolerance of a new drug of a similar class. So, for example, if you have a tolerance to, let's say, you have a tolerance to Adderall because you have ADHD and you take Adderall all the time. Well, for those of you that don't know, Adderall is an amphetamine, right? So then if you have a tolerance to Adderall, you could probably take meth and you would probably have a pretty good tolerance to that because methamphetamine is an amphetamine too, right? So these are two very similar drugs, if not almost the same. I'd like to talk about that. You all wrap your mind around that. That you see meth as such a bad thing, and the stereotypes that go along with meth use, but it's really kind of the same drug that they're prescribing to people for ADHD. So, is it really all that bad if we can really use it for ADHD? That's a good question, right? Anyway, drug abuse, drug dependence, and misuse, these are all terms that are used. NIDA, defines drug abuse as any illicit use of a substance. They say that, if you're using an illicit substance, it's abuse. Um, you know, Someone that smokes marijuana in a state where it's not legal, is that really drug abuse? I wouldn't say so. But that's the way NIDA explains it, right? Um, One thing that you all might take note of is sometimes your book will say things, and sometimes I'll say something different. I have a different opinion of your author sometimes, and that's fine. Um, but what I try to do with test questions is to not so much as ask you something like that. A lot of times I'll throw in a question and say, your book says this, but your professor thinks something else. What does your professor think? Or something like that. So these little tidbits of things where I digress and I go to talk about how something might be a little bit different than the way NIDA defines it or something, might be something to take note of. So then drug misuse. Drug misuse is a little bit different than drug abuse, right? So drug misuse is taking something that's a legitimate drug and misusing it, right? So we see this all the time with various things. Taking prescription drugs that aren't prescribed to you. Mixing Percocet and drinking, a 12-pack of beer would be misuse because you're not supposed to drink with the Percocets, right? And that would cause what is known as a synergistic effect, the ability of both drugs to be combined and then give the person a greater effect from those drugs, so to speak. So anyway, drug dependence and addiction. Drug dependence is obviously pretty clear. That's when someone is so used to using drugs that they depend on them in order to be able to function in their life. Someone with a heroin addiction almost always will, if they continue to use it, become dependent upon it. They won't be able to get out of bed or function without being sick and going through the withdrawal process. And so they become dependent on these things in order to carry out their everyday life. Addiction is usually an inability to stop using the drug. Usually you'll see addiction before you see dependence. Sometimes with more powerful drugs, you might see them all at the same time. They might start, but usually someone will become addicted, which is their inability to stop using the drug, right? And lack of control over their use. And then that leads to dependence. Anyway, I've already kind of talked about withdrawal symptoms, flu-like symptoms, cramping, nausea, diarrhea, trouble sleeping, convulsions, and even death. You all might not know that alcohol is actually one of the biggest things that people can have withdrawals from. People who are alcoholics actually have to go to inpatient detox centers, just like heroin addicts. Those of you that, of course, are above 21, I know nobody below 21 would know this, but the next morning after staying up late at a frat party or something, you might feel a little under the weather, right? It's commonly known as a hangover, right? Well, guess what? Those symptoms that you're feeling the next day, that hangover, that's the withdrawal symptoms of alcohol. So you're actually having a withdrawal every time that you have a hangover, so to speak. And I know there's different ways that people use different things to get over that. To deal with their withdrawals, right? You see the same thing with other drugs. Some drugs you won't see that much of a withdrawal from. It really depends. Marijuana, people tend to just get really sleepy and want to doze afterwards. But anyway, um, factors influencing a drug's effect on behavior and mood. It's often inconsistent and unpredictable. There's different routes of ingestion, right? Some things are smoked, some things are snorted, some things are swallowed like a pill, some things you can inject, right? There's some drugs that you can do a little bit of everything with, right? Cocaine is commonly snorted, right, up your nose with a straw or dollar, but it can actually be injected. It's not very common. Some people smoke marijuana. Sorry, not marijuana. Cocaine, right? And crack cocaine is really always smoked, and it's really just cocaine with baking soda and water and heat added in order to make it into a harder substance within the smoke. Makes it more concentrated. So to speak. You might know that marijuana can be smoked, which is the most common way of using it, but some people also eat it, right? Make brownies and other types of edibles, so then it's swallowed, right? So there's different things. Dosage is the overall weight of a drug, including any additives. So the dosage it varies, right? And potency. Now, potency is the amount of the drug needed to produce the psychoactive effect. Um, so if you have, it can vary based upon the type of marijuana that you have, right? Someone might have some really good indoor grown stuff, and someone might have some outdoor. I forget what you call the really dried up marijuana these days, swag or something like that, right? And then purity. So you see that a lot with different things that are in powder form, like cocaine. Very rarely will you find that your cocaine that you're getting will be 100% pure. If it is, then that's just completely rare. Usually, it's a very, very low percent of actual cocaine in the powder that is coming through, unless you're living in Colombia or wherever it's actually made at, because all along the line, people are adding baking soda and baby laxatives and all kinds of other stuff in order to make more profit, so it's less pure. Anyway, so classes of drugs in the Drug Enforcement Administration schedule. So the I think your textbook has a picture of it in here, if I recall. But if not, I will post one online for you all to see. Yeah, it does have the schedules on page 20. So you can see the drug schedules on page 20. And I think that's a pretty good table to look at if you want to see. And you can go, and I'll post online the link to the actual DEA schedule if I think about it. If not, you can obviously look it up. But there's 5 basic schedules. Schedule 1 is drugs that it's completely illegal to possess. All the drugs in there are illegal, and they say that there's no medical usage. One of the things that I've often found very interesting, and you'll probably find it interesting as well, is that marijuana is up there in Schedule 1. There's no medical use for marijuana, apparently. And so, why? I don't know, because marijuana has been used for thousands of years for, nausea and various other ailments. It's currently being used in many, many states for nausea for cancer patients and various other things. So it does have some medical use. The DEA, who gets to decide what's scheduled where, obviously disagrees. And they put it up there. I think heroin and LSD, mescaline, peyote, quaaludes, hash, and stuff like that are up there. So essentially, marijuana is in the same category as heroin. So that's interesting, I think. Heroin is a very similar drug to morphine and opium and things like that, though. So it's interesting that that's up in Schedule 1, too. To be honest, I don't think that many of these things, you can say there's no medical value to them at all, right? Interestingly, you all might not know the development of how heroin was developed, but heroin used to actually be a medicine that was given to soldiers when they were being operated on and such. And then what happened was is people would get addicted to the heroin and they couldn't get them off of it. So then they developed morphine in order to give the soldiers instead of the heroin, and they used that to kind of wean them off of that. And so now we have morphine, but of course people overuse that as well, right? So it's interesting because it doesn't seem to matter what drug it is. If people have the potential to misuse it, then they will. And is that necessarily a bad thing? No. I mean, that's up to you to have your own opinion, I guess. Anyway. So this was the 1970 Comprehensive Drug Abuse Prevention and Control Act, which actually created these scheduling classifications. I think I mentioned a few minutes ago that the DEA is the one that actually gets to decide what is in these different schedules. I think that has something to do with why marijuana is up in Schedule 1, because the DEA has an interest in keeping up their business, right? And those of you that don't know, we'll cover this later in class, but the vast majority of drug arrests in this country are made for marijuana, right? It's the most commonly used drug, and so there's an interest in keeping that illegal at the federal level, which is why it still is. You might see that change in a little while someday, maybe in our lifetimes. If not in mine, then probably more so in yours, at least. But anyway, and then not to digress, but then at the bottom you have Schedule 5, where you find drugs like cough medicine and stuff like that that have a very little potential for abuse, but they're seen as having a very high medical value, right? But then again, you can still take cough medicine with codeine in it and drink a lot of it, and they'll get a little buzz from that too. People have done that before. But anyway, so no-knock searches were also a part of this legislation. that you could just kind of do an unannounced search for case-by-case basis. And the National Conference of Commissioners it's also served as a model for state anti-drug laws. Obviously, it's not that big of a model anymore because many states are starting to legalize things that go against this. So I'm sure you read that in the chapter as well. So looking at the different classes and types of illegal drugs, I already mentioned that marijuana is a Schedule 1. It is a cannabis sativa, THC. For those of you that don't know, THC stands for tetrahydrocannabinol, which is the active ingredient in marijuana, which actually gives someone high. What you see when you see CBD oil and other things being sold is marijuana that has actually had the CBD, I'm sorry, not the CBD, the THC taken out of it. Now, marijuana tends to be put in kind of a class all of its own when it comes to drugs. There's some people that would say that maybe it's a stimulant. Some people are starting to say it's a depressant. And this really gets at this difference between what is known as sativa and indica. Um, when I was your age, they didn't really have all these differences that I was aware of, at least at the time. But nowadays, you have a difference where indica tends to kind of relax you and make you kind of more mellow. Sativa apparently is very uplifting and can cause you to be alert and things like that. And so that's really interesting. I find that the same drug can have different effects if it's a different, different type of that drug. Anyway, so for those of you that don't know, this should be in your textbook as well. The Marijuana Tax Act in 1937 is what caused marijuana to be illegal at the federal level. Prior to 1937, marijuana was completely legal, and so it was used for medical purposes for many, many thousands of years up until 1937. There's a big debate over why it was made it illegal. Part of it was because of this guy named Harry Anslinger who did not want to lose his job. There's also the idea that it was part of the pharmaceutical industry because of the development of the hypodermic needle, which was because marijuana is not soluble in water. It will not. You can't use the hypodermic needle to inject it, and so it can only be smoked or eaten, things like that. You can't really inject marijuana. That wouldn't work too well. For those of you that don't know, too, while I'm on the topic, marijuana not being soluble in water is also what makes marijuana last in people's systems for much longer. Marijuana can stay in your system for up to 30 days, whereas pretty much every other drug is out of your system in 2 or 3 days. The main reason for that is because the main way that our body uses to cleanse itself of toxins such as drugs is through water. I forget what the actual percentages. What is it? Our body is like 80% water and stuff. So that's actually very true. Marijuana, it doesn't dissolve in water. I wouldn't recommend anyone testing this, but if you put some marijuana in some water, it's not going to dissolve, right? But if you take some Percocets or some cocaine or something like that and put it in a glass of water, it's going to dissolve into that water, which is essentially what's happening in our bodies, right? And so since it doesn't dissolve in our bodies as quickly, it takes much longer to get out of your system. And then, of course, there's this whole gateway drug debate regarding marijuana, right? The marijuana is the gateway drug, and everybody who uses marijuana is going to go on to use marijuana or to use other drugs, sorry, which is not necessarily true as well. We do see that most people who have gone on to use higher drug or other drugs such as cocaine and heroin and stuff like that, they did tend to smoke marijuana before that, but most of the people that smoke marijuana don't go on to use these other drugs. There's also some research that shows that alcohol is actually really the gateway drug, that more people use alcohol first before they use marijuana. Anyway, looking forward now to what is known as a depressant. These are usually your opiates. So heroin, morphine, all of those things, Percocets, a lot of your pain pills that you'll see. when you have surgery, things that they use for medicine. Um, Fentanyl is actually a depressant as well. And so, for those of you that don't know, when you overdose of these drugs, what happens is your body is so slowed down that your your breathing is depressed so much that you forget to breathe, and you can't breathe because you can't move your muscles in order to be able to breathe. Uh, Ordinarily, we just breathe without even thinking about it. But when you overdose on these things, that can actually have that effect, and that's why people just they kind of die of suffocation because they can't breathe because they can't move their muscles. It sounds like a very rough way, but anyway. Heroin is a chemical derivative of morphine. Like I said, depresses breathing and your heart rate. It'll actually slow your heart rate. Um, you know, some people tend to go to sleep. Heroin, people tend to say you have what's called the heroin nod. Like people will be awake and they'll kind of start nodding, and so that can happen sometimes as well. Generally, it all is derived from opium and the poppy plant. For those of you that don't know. So there are also synthetics. Your Vicodin, your Percocet, OxyContin, Demerol. You probably might be too young to know what Demerol is. It's essentially a pain reliever as well. Hydromorphone, and of course your fentanyl. These are known as tranquilizers or downers. These are sedative hypnotics, such as your barbiturates. Quaaludes are one of those. And so you can't really get Quaaludes anymore. They were put in Schedule 1 back in the 1970s because they were a very strong pill that was used for medical purposes, but then it was abused by a lot of the hippies so much that they made it Schedule 1 in the 70s, and now it's no longer used for medicine. In this category, you'll also find your benzos, what is short for benzodiazepines. Some of you might know them as Xanax. Xanax is a type of benzodiazepine. Um, this is a newer and safer class of a downer. Some people use Xanax and Valium for anxiety and things like that. And so uh, that can have some effect on people. It also slows down their central nervous system. Imagine someone who's having an anxiety attack and is really worked up. If they're really worked up, then you give them a downer, it kind of calms them down, so to speak, right? And so they can have that effect. Now, moving along to your stimulants. So if someone's having an anxiety attack, the last thing you want to do is give them a stimulant, because then that's just going to speed up their central nervous system even more. Um, so stimulants are a very big concern amongst law enforcement and other things because of the violence associated with methamphetamine, cocaine, things like that. Obviously, if you're highly stimulated with one of these drugs, you can be much more violent and can be a bigger problem for the police to get under control. Someone who's abusing downers, the benzodiazepines and heroin and stuff like that, that's not much of a problem because they're not going to have much energy to resist very much, right? Then again, your stimulants are the opposite. So these increase your central nervous systems. They speed it up, so to speak, right? Your cocaine is a fast-acting ingredient. It actually blocks a dopamine transporter that results in a buildup in the synapse manifesting these feelings of euphoria. So essentially, cocaine actually stops some of the blood from getting to your brain the way that it's supposed to, which is actually what gives you the high from it, which is interesting. And because it blocks the brain from getting enough blood, what it does is your body increases its heart rate and breathing and everything else, which is causes this stimulant effect, trying to get more blood to your brain. So your heart beats faster, your lungs breathe more, trying to increase the blood going to your brain because it's not getting enough. And so that's how you get that effect. Did I already? Yeah, okay. So crack cocaine is pretty much the same thing as cocaine. You see a lot of the differences, and we'll talk about this when we get to sentencing, when it comes to people sentenced for crack cocaine versus regular cocaine. And like I said, the only difference between crack cocaine and regular cocaine is what they do is they take usually a spoon and they put some cocaine in it with some baking soda and some water, and then they heat it up with a lighter, and then and they scrape the cocaine off of the top, and it hardens into a rock. And so it's just more concentrated. Your amphetamines. Ritalin was popular for ADHD back when I was your age. Now, more common is, gosh, I was just talking about him earlier. Uh, anyway, I have lost my thought there. Not Ritalin, but, oh, it's going to come back to me, Harris. I've forgotten the name of what I was just talking about it. Anyway, I'll move on and come back to it. And benzodrine, not benzodiazepine. But anyway, these things tend to suppress your appetite too, so they're popular amongst people who want to diet and things like that. Adderall, that's what I was talking about. Adderall is used in the place of Ritalin commonly now, although they still prescribe the Ritalin somewhat. Anyway, methamphetamines, you all have probably heard of meth before, right? It's quite popular in some areas because people can make it themselves as long as they do so without blowing themselves up. Uh, I forget the types of things. There's pseudoephedrine that you need, which is commonly found in or not cars. I'm thinking of cough syrup, cough medicine, pseudoephedrine, and then another chemical which is found in something named heat, which you can get from the auto parts store, and then essentially they make it, mix it all together, put it in a microwave to make this chemical reaction, which makes the methamphetamine. But if you don't mix it properly, it can blow up in the microwave, which can cause problems, obviously, if you're nearby. Uh, obviously, these amphetamines can be useful in some instances, right? Such as treating narcolepsy. For those of you that don't know, narcolepsy is a problem where people will tend to fall asleep randomly throughout the day. And so if they're given amphetamines, this can help to keep them awake. It has always befuddled me how uh, this is used to treat people with ADHD because you're essentially giving someone who has ADHD, which is hyperactivity, and an amphetamine, which is an upper, which you would think would make an ordinary person, it would stimulate their central nervous system. But I am told by the medical professionals that because of the way people with ADHD's brains work differently, it has the opposite effect on them, which is fascinating. And I'm obviously not a medical doctor, so I will not try to argue with their logic. Apparently, it works. So, anyway, hallucinogens are the last thing on the list, and so they're noted for LSD and things like that. You all probably would put some of your club drugs in this as well. Magic mushrooms, if you've ever heard of mushrooms. LSD I don't think is as popular as it used to be. But anyway, PCP is actually put in the hallucinogen category as well, which is a Schedule 2 drug, and it has some hallucinogenic and stimulant properties. You've probably heard of people going crazy and killing people on PCP. And then there's your mushrooms, your peyote, which is also mescaline. Peyote is actually allowed to be used in some sorts of areas. Out west, I believe there's some Indian or Native American reservations that it's authorized for them because it's part of their religious ceremonies to be able to use peyote as part of their experiences. And then you have your club drugs, ecstasy, GHB. Ecstasy is your MDMA. It's what you see all the people used to be when they would go to the club and have the lights going and all of that stuff. They would take ecstasy. Oftentimes, when I was younger, they always had the sweatshirts on and they had a bottle of water, and I forget what type of water it was, but there was some kind of flavored water that people loved to have. But anyway, I won't digress too much. So you have those. And then you also have probably heard of Rohypnol, which is also known as roofies. Hopefully, none of you have had any experiences with this. This is commonly known as the date rape drug, and what will happen is that people will put that into people's drinks when they're not paying attention, and it can have this sedative effect. It is not illegal, or it's not legal in the U.S., and is very hard to get, luckily. Um, so there is that. Hopefully, nobody knows anything about groupies. Anyway, ketamine is actually a horse tranquilizer, which is actually has some hallucinogenic and sedentary. It's two different words. Anyway, effects, and it does not depress respiration or cardiac function. But it can help you to hallucinate. So there is that. That is the end of what I have for today. So I thank you all for paying attention, and I will talk to you all next time. Please let me know if you have any questions. Thanks.